Lights, cameras.
This is swanky. This is lifestyle. This is culture. Welcome to the social center of everything culture. Culture Daily.
Yes, if you guys right, it is time for the big conversation, and like we mentioned, Dr. Chris is here.
I'm not here.
At this point, Dr. Chris is
I'm not
family. Here. Okay, so yes, we
1 year, right?
We'll just give you a short welcome, very short welcome.
I said last year around this time. I said
around this time.
around this time.
Really? He's been with us for a long time.
Happy birthday, Dr. Chris.
Happy birthday.
Happy music birthday.
Indeed.
I need
Chris,
a plaque.
what are you doing for us?
I need a plaque.
Be your birthday.
I need a plaque.
What are you doing for us? Because you know in Africa, not much is done for the birthday person.
So
you rather do something for the people celebrating you. So
it's like Christmas.
It's
It's just but he gets nothing.
Yes, he gets nothing. We get everything. So please, what are you doing for us?
A baby brother Nicosia.
Oh, that be doing that one is regular. No, like we don't like
regular.
burger, like something.
Burger.
If it's still
Ghanaian
bread,
burger. It's bread.
it's still
So a
bread, but we
sandwich.
want
What's that sandwich?
burger, sandwich, something. Don't give us Budoni Nkosia. Why?
Breakfast.
Breakfast
basket.
Why? Yes.
TZ.
Oh, that's not bad.
Okay, well,
That's not bad.
It's not bad.
But anyway, you're welcome, Chris. Today we want to get to know more about STIs beyond what our friends tell us, beyond the advices some friends will give about treatment of STIs, beyond what some parents claim works for STIs. Okay, so starting with knowing what STIs are. I know that is broad. There are so many STIs that we can look at, right? But let's look at the umbrella term first, and then we break down.
Right. Formally, you see in certain places it's called STDs. It used to be called STDs. Then it changed out stigma and all these things. They changed the word to STIs. But the difference is that diseases have symptoms. Infections sort of don't.
Okay.
So you can have certain infections that don't show any symptoms. Like the HPV we talk about. It could be in your system for long and no symptoms. But with the disease, if you classify all of them as disease, then sort of someone says you have syphilis. It's not, we can treat it. Is it a serious disease? Okay. No. So the STIs they felt it was a much milder term. So it's self-explanatory. It's sexually transmitted infection, meaning an infection that you get in any form of sexual contact, which is either skin to skin. People forget that part, that you can get an infection from skin to skin, like hepatitis.
Yeah.
Like herpes. Like HPV, when you get the warts and the pustules, the fluids, you can get infected. Then you have oral, which we talked about last week.
Is it Operation Return all this?
No, this one is.
Okay. Sorry.
Yes.
I just had
You
to
should have said yes to him because he well knows what you're talking about.
Then you have vaginal sex, anal sex. Those are about the 4 categories of sexual contact. Now, the reason why this has become so prevalent. So before we were talking about that. Why is that for a long time there used to be this advert. It used to tell you that prevention was A, B, C, D.
Yes.
You remember that advert?
Yeah.
Do you remember what the A was?
D?
Yeah.
Abstain.
Yes, A was abstain. B was
Be
what?
faithful.
Be faithful.
Condom use.
Condom
I
use.
don't remember a D.
So when you go further, D is drugs. So you can be either taking your medication, those who are tested positive.
But was that popularized as well? Because
No,
I
it was the only
honestly just
ABCs that we don't talk
remember
about. Yeah, but when it comes to healthcare, we added the rest because
Okay.
So we do the D's as those who are infected, adhering to your regimen, your drug regimen, and all that, and then the D also for those who use syringes to inject this illicit drugs.
Okay.
They also have a risk of getting sexually transmitted infections because when you share the needle with somebody else, you also. So the D was for that.
Okay.
Right. Now.
Right. So, based on this explanation, would you say that there is then a difference between the sexually transmitted diseases and the sexually transmitted infections?
Right, there is. So in sexually transmitted infections, you can graduate from an infection to a disease.
Okay.
Remember when we talk about HPV, you have symptoms as just genital warts. It's not a disease yet, but you could graduate that to getting the full-blown condition where you are getting cancer out of it, you are getting sterility out of it, not being able to conceive out of it. You can also go from gonorrhea, which starts with a burning sensation when you urinate, to having severe conditions where you lose the ability to have a child.
Okay.
So, an HIV also starts like an infection. Then it gets a full-blown AIDS, which is the disease. See how the graduation is?
Yeah.
Because when it's HIV and we see it early, we can treat you and reduce your infectability. But when it gets to AIDS, that one, we just make you comfortable until the Lord calls you.
Okay.
Right?
Yeah.
So that's why we are always advocating. 3 minutes, I was always advocating. Oh, people should get tested, right? Now, when we started doing this thing, the question has always been that people ask, if I don't have and my partner doesn't have, can I infect the person?
If you don't have and your partner doesn't have, how would you infect the person?
So yes and no.
Okay.
In the sense that we talk about latent disease conditions that you can have, but when you test it to be negative.
But it's there.
It's there.
Okay.
So you tested, both of you tested, you are negative. But subsequently, along the line, 4 months down the line, somebody gets infection. So yes and no for that question.
Okay.
Right? Now, the risk of this, and we always talk about infections as being adults having sex, but right now I realize we come to an advent period where people, where people who are molesting kids, we're having kids have infections, come home with HIV. We have young kids who live with guardians come with sexually transmitted infections. We've forgotten how to use the condom. Some people are doubling it.
I think you should say some.
Some people have forgotten how to use it because some people are doubling it.
Huh?
Yeah, somebody they double it. The person doubled and still got the infection.
Oh, so that one is a fear. There's nothing you can tell me. You are doubling condom
Not
and
one,
still. No.
They are wearing red socks.
So what happened was that by doubling, you are creating an infection.
Christine, okay.
You are creating friction. Sorry, you are creating friction, right? So the two layers, it makes it easier to break. So it caused it to break, and the person got infected. So though in his mind he's using two, so yeah, no.
Wow.
Even certain lubricants that people use with condoms can destroy the condom. Because it's latex. If the lubricant is too aggressive, it can break the condom.
So that means that also now in getting the education, in using condoms, you need to get the education about proper usage as well.
Right.
And then also which lubricant you should use if there's a need to
use
that.
one.
Wow.
Yeah, because it's latex during the sexual intercourse, because whether it's oil-based or water-based it gets dry.
Okay.
Because certain females react, your partner might react with the latex condom. Some can get irritation, allergic reaction to it. So they stop, for lack of a better word, they stop getting wet, start getting dry, which then is painful. So then you want to apply a lubricant, which then also goes to destroy the condom.
Yeah, so it's not small signs that you need to know to be able to do this.
So you see why we say either you abstain or you stay with one monogamous, like you stay with one person.
Yeah, be faithful.
Yeah, be faithful to one person.
Yeah, but Doc, here's the case where I think that we live in a culture, or there's this growing sense of, I don't know the word to use, but people feel freer these days to indulge or
sexual liberation.
Yes, sexual liberation
or exploration.
Wow.
Yeah.
Wow, sexual liberation.
That's a catchy word.
Yeah.
Sexual
Because I think that's what
that's what it is.
right?
People are sexually liberated and feel like, oh, it's just sex, so I could have as many partners. I can have as many partners as I want, and it's fine. So in the case where now we have that, because you're preaching at least like finding one person and sticking to that, right? While others would also suggest that you should marry before. If you marry before indulging in sex, then you can avoid all this entire
nowadays marriage doesn't even count, because the married people, both men and women, are reportedly cheating on their partners. So some of them. So that even doesn't count.
Reported.
Yes, yes.
Some.
Some and reported, please. It's in caps. Please.
They said it. I didn't say it.
So look, I mean, in this instance, we obviously have to find ways to like mitigate, the spread of these diseases or these infections. What do you think that is the way forward? What are people supposed to do? How are we going to be able to encourage people to get to these tests and all of that? Because on their own, a lot of people wouldn't go because of fear of stigmatization, amongst other things.
Yeah. So my hats off to Theory Music for doing this, trying to educate. Since last year, been trying to educate people.
Yes.
Because I meet a lot of young people, and if you ask them where the information is coming from, they'll say, "Oh, we heard you say it here. We heard you say it here. Theory Music said this, and that. Is it true? Is it?" And then they come for clarification, which is good, because it means that there's a lot of misinformation out there, and it's sort of Theory Music is championing that. Okay, let's clarify this. What you heard, bring it to the table. Let me clarify it. You might not be wrong. What you heard, there may be truth to it. That's why you always say people should ask their questions. People should ask more. Now, people don't ask more anymore. People just do it. They see something, they just do it. Before it was you see something, you ask, does it taste good? Yeah. Can I try this? Then person will tell, oh, if you try this spicy, if you try it. No. Now it looks good, I'm doing it. And the risk has gone up because you mentioned the word sexual liberation. Somebody did this, a partner is talking about, a friend is talking about this, oh, we did this, have you tried this, have you tried that, have you tried this in the car, have you tried this in the hotel, have you tried, like, it's like a bucket list. People are taking boxes, like it's a bucket list of things that you should do, and if you're not part, hanging upside down. What's with that one? Wheelbarrow and things.
I don't clear. When you get to the hospital, you explain.
Like, how do you end up here? Yeah, how do you?
Doc, I wonder how people explain themselves something, because you get to the hospital and maybe where you're coming from, you were in the middle of action and they get there and maybe like you're saying, maybe the person gets a heart attack or how do people explain when they get to the hospital?
So you have, let me give you one prime example.
Okay.
A patient who has seizure. Wow. She's diagnosed epileptic, right? Yeah. She doesn't tell the partner. Maybe she's not taking a medication, but sometimes due to the excitability of the whole process, the seizures are neurological, so electrical. So she's can I say it on? She's giving oral something to the gentleman, and then onset. So her teeth grabs the whole thing.
Yay.
Oh wow! And if you try forcing it, it's going to get worse. It's going to just come off, right? Because neurological seizures, they don't last long. They are for a few seconds and then it passes. He freaks out. So he freaks out, and instead of him probably waiting for it to pass, he forces and then he gets a cut. So then both of them have to come in for treatment now. And taking the history from both of them, how you
explain it. God will help you explain. He will give you wisdom, knowledge,
to explain to us what really happened.
To explain what happened.
When you are taking the history and taking the notes, right? At point in time, you write and wondering what you are writing. It's like, did it really?
Did it really happen?
You can't read this and say this really happened. Like,
yeah. I can't imagine what you people see, in the theater and in the hospital. But was a very common STI that you have?
The common one we get is gonorrhea.
Okay. And gonorrhea, right, Doc? I'll think that is a man thing. Okay. Yeah. Right. But is it possible for females to also contract gonorrhea?
Yes.
What
please.
are some possible causes of it, and then also treatment? So
I better show an image of it. I'll show an image. Okay. If Debbie will kill, I want to use the image to help me do this.
Would put up the image later, but just run us through while production prepares that.
When the first time gonorrhea started.
The first time gonorrhea.
The first time.
Sorry for the distraction, Doc.
Yes.
But yeah, the first time.
The problem with gonorrhea is that people mistake it for UTI sometimes.
Okay.
They mistake
for the ladies.
Yes, for the ladies, they mistake it for UTI because they are similar in symptoms.
Okay.
The burning sensation, the discharge, the itchiness, the redness, same classical symptoms of gonorrhea.
Okay.
Right. But the difference between gonorrhea and UTI is that UTI, when it comes to a burning sensation, you'll be able to pee, all right. But gonorrhea, you feel like somebody lighted fire.
Is this for both male and female?
For male especially.
Okay.
Right. For male especially. Now, the reason why it spreads a lot is because of oral sex. People think that you can't transfer from your mouth to the vagina or to the penis, or the other way around. It works both ways. So the infection is in her vagina. He can get orally. He can get gonorrhea in the mouth.
Oh.
Yeah, it's not only down there.
There's mouth
gonorrhea.
gonorrhea.
Yeah, you can get one.
What's a symptom for that?
That's really serious.
So you get the oral thrush, you get the sore throat.
Oh.
Yes. Then the same person has it, right? Let's say he's promiscuous, so he does it with somebody else. Then later you're like, oh, go down on me, and he goes down on you. He's going to leave it with you.
But it will be down
so you won't
there
get
for
a sore
you.
throat. Yeah, you won't be. He'll be getting sore throat, thinking it's a cough, and be doing treatment for a cough. You and the other one will be treating. So yours is tested because the location won't
Exactly.
think is there. That's it. You go and treat yours for, and then
At this point,
and then you begin recurring infection because he will keep coming to you.
At this point, treat your sore throats as well.
Yeah.
Because you never know what's
Tested up.
Oh,
the
what is
underlying,
happening?
you know,
Of
of the
we have
sore
the
throat
images
is.
now, Doc. So,
Yeah, so
we can put that up.
This
while
one,
you run
that's what
through
I
it.
wanted to see. So I have an image for you that I designed purposely for this purpose. So I divide the male and female.
Okay.
But I don't have space to, right? So the blue is the male. If you're
But it's
watching,
understandable. I
yeah.
think.
So the blue is the male. The pink is it pink? It's
yes.
pink, right?
Yes,
Is
it is
is the
pink.
female. Now you see the female. It says unusual genital or vaginal discharge, thicker or colored.
Okay.
Now this, if women know this, they tell during ovulation some of them get discharge. So if you don't know the difference, you might think this is okay. It's a regular
discharge.
occurrence.
Okay.
Then you go on pain or burning sensation while urinating, which UTI has the same thing sometimes. Then you have pain during penetrative vaginal sex. You think, oh, he's too big for me. Oh, I'm too dry. So you can explain a lot of these symptoms with common knowledge. The next one, an urge to urinate more. That's where the problem starts.
Okay.
You've
this
taken
as
water.
well-
You've taken water, or you've not taken water. You feel like peeing. You go to the washroom, nothing's coming. Because then it's burning, nothing is coming. Then you step out before you know you are wet.
Abnormal vaginal bleeding as well.
Abnormal
but these
vaginal bleeding.
symptoms are scary because it's possible that the person will think it's menstruation.
Right.
Also because of the vaginal discharge.
Right.
And then as well, maybe the bleeding, the vaginal bleeding.
Right. So you see where the guy will go. If you look at the third point for the guy, changes in color and swelling of the testicle. Swelling of the testicle can make a guy go to the hospital.
Okay, yeah, because you know that there's a problem.
There's a problem. With look at the female one, unless it's unusual for you, maybe the bleeding is coming at a time when you're not supposed to be bleeding. Then you're like, okay, no, this is not right.
Okay. And with this bleeding as well, does it come with clots? Because menstrual.
It can form clots,
It can.
or it can,
Okay.
or it can cause like bright red bleeding because maybe you could have had penetrative sex, which caused scarring. Then you later on he's gone home. You sleep, you wake up, and you're
bleeding.
yeah,
Hey,
yeah.
it beats in so. Okay.
And with the male one, you see, you have a pass or discharge even when you are wearing your pants. You've peed already, but you open like the way. Ideally, a man is also have a discharge in his pants when you wake up or when you're walking around. You don't see that unless maybe you don't take good care of yourself.
Yeah.
He wakes up and there's discharge in his pants, yellowish or white or beige in color. If it's greenish, it's worse.
Green.
Yeah, if you move from white, yellowish, creamish, and you are getting to green, you are
Problem day.
your spectrum.
Going it means you're about to go.
Wow.
Wow.
Okay.
What?
Okay.
Go.
Go.
Green means go.
Wow.
So go to the hospital. Green is go to the hospital.
Go now.
Yeah.
Go now.
Go now or you go.
Yeah.
So the common one is the burning sensation everybody knows for gonorrhea. Is the burn. So it's caused by Neisseria gonorrhea. It's a bacteria that causes it. Now the reason why this is so popular is because it can be with you, and then you think you're okay. Then you unprotected sex. Then you move on to the next person. Another common one is HIV. Everybody has it, but they've not tested. So I always tell you that everybody has it in this country.
Oh, how do you
Yeah,
mean?
because until you test, you can't tell me you're
not
negative.
Sure. Okay. I get what you mean now.
That's why when I say people like, well, you can't say that. I say, yes, I can say that. Until you show me proof that you are not, then
You are.
chances are because you cut your hair. That's a risk.
Yeah.
And the worst one is those who do the nail thing, the pedicure thing in the market, the guys with the scissors and
that
stuff.
One, yeah. The people who go through it.
Yeah, so when I talk about sexually transmitted infections, people think we've got it from it being only sexual to so many other things. Do you also know that herpes simplex virus, HSV, you can transmit it from your towel? Your partner visits you, he doesn't come with a towel, she doesn't come with a towel, right? When you use somebody's towel, I have two. I use one for my face, like, I don't know, and then the other rest of, some people have one, so they clean their face and the towel.
You shouldn't even have one towel, okay? Ideally, just use a paper towel or tissue for your face, and then you use a towel for your body.
I'll take that.
Yeah.
So some people have one, so they've done whatever they need to do, they finish the whatever intercourse it is, they take a shower, he hands over his towel to her, she's gonna use it, transferring whatever he has, the herpes, to her.
Ish.
It's like these days you can't even breathe around someone.
I was just going
Like,
That's actually really scary,
That's a
right?
lot.
Because what is she going to do? She's going to clean down there.
Oh my Jesus.
And because they are this one, the bacteria, they are in the towel, so you can't see it. So you rub when you transfer.
When you are going, you see, take
I
notes.
wash
When you are
here.
going, take your towel. Take your towel.
You
And
will
your
say
sponge, whatever it is, don't go. He says
You
don't
say
go.
don't go.
Yes.
No, because let's be honest, they will go. Like you
I was
think they are going to listen to you and I
That's
telling
why-
them not
that's
to
why-
go.
Today was Tuesday.
go.
Somebody's bag is packed for Friday.
Oh.
It's like
No,
by the
somebody
door.
is still there from Friday. Right? Somebody is still there.
there.
But Doc, you mentioned gonorrhea. You
Yeah.
mentioned HIV. Which other common one is there?
Then we move to
Syphilis.
syphilis is not common these days as it was. Yeah, I think the advent of a lot of takes a lot for you to get syphilis. Like takes rigorous sex, frequent. Like you have to constant infection for you to really for you to get there.
Constant infection
Yeah.
is a lot.
No, some are severe that one touch they start replicating. So that's what makes HIV so dangerous in the sense that it uses your own mechanism of replicating cells against you. Your own system of manufacturing new cells, it enters your DNA, DNA says this structure and say, oh, I'm part of the structure now. Then it starts multiplying itself.
I'm home.
Yeah, so right now what we are doing is that most of the treatments are helping because we're able to reduce your viral load so low that when we test you, it will be negative.
Okay.
Because there's
So-
no replication.
There's no replacement. So the treatment is either you stop it from entering the cell, or when it enters the cell, you shut it down. Shut down the system for replicating. Right? So when we tell you to take your medication, that's why we have pregnant mothers who have the virus and they are taking their medication to prevent the virus from transmitting to the child. That's why somebody with HIV who is pregnant can still breastfeed. But we tell them to breastfeed only one way. Either you are doing exclusive breast milk or mixed food.
Okay.
So you don't do mixed feeding. The reason being, gut flora, the child's gut, is so thin that when you start mixing liquid, solid, it can cause strictures, tears in this one, which will make it susceptible to the blood to the virus to enter through there. So either you are doing one, and as long as the mother is on the medication treating her well, the child will not get it.
Okay, so now, Doc, with gonorrhea as well, I'm just wheeling back because that's one of the common ones that you have mentioned, right? What are some of the ways that people crudely treat gonorrhea that you know about? Also, because I think that because it's very common, because a lot of people speak on it, you often hear people who sell herbal medicine say that, they have treatment for gonorrhea. Is it possible for herbal medicine to treat gonorrhea? If not, what are the ways that it can be effectively treated so that there's no reoccurrence? And then also for the women as well, how should it be properly treated so that it's not going back and forth between partners for those who have decided to stay faithful?
So let's do the herbal thing. The question with herbal, healthcare has nothing against herbal.
Okay.
Let's get this right. We have nothing against herbal. Our issue is if it's not being approved, by the FDA and Food and Drug. So I don't think people should go near it. Just like those ones where there's no dosage. There's no dosage. We will tell you take 10 milligrams, take 5 milligrams, take 10 ml of that.
But they will give you a cup.
But they tell you a cup, and it works for you. Maybe you take 3 cups, you are fine. Then you meet me and I'm telling you same thing like, oh, me baby na a man went to. So then the cup, one of the cup you are using at home. You don't know what cup I use at home.
Yeah.
Maybe you use a teacup, like a really British teacup, and I'm using like a jug. And I go up like bonsoir. There was this metallic one.
Yeah.
My grandpa had one.
Oh yeah.
5. Yes. Then he had this ceramic one. It was coated enamel, like an enamel cup.
It's usually white.
When you drop it, chips, the paint starts chipping off.
Yeah.
Those people with those cups, imagine he's in a hurry for the thing to you drink what small cup. Oh, wow. 3 days yours, person contempt. Oh, bunu gallon or shenema. Then you have side effects, kidney, liver, everything starts shutting down. Because every drug, we always talk about it. Last time I talked about drug, I told that every drug has side effects. Even food has side effects. Something is always left behind. So somebody tells you, and the worst part about this herbal thing, they can treat like 100 things.
Yeah, the same.
Yes.
It's a
disciplinary drug.
No, it's more multitasking.
So jiba and crossa HIV, hepatitis. Oma pacho no mienu na one to work doctor. Wait, you want to do 3 days before you get to ask?
Dog, he has given you disclaimer. He has given you disclaimer.
It's true.
Like, yeah.
Actually, if you think about it.
And the worst part is when I've taken a vehicle where one stood in the vehicle with us, and unfortunately for him, about 10 of us were doctors. So he starts and he's saying that this thing, I think it was custard seed or so. I know this seed, if you react it to milk or something, it becomes poisonous.
But he was asking.
He was doing a lot of these things, and he said he creates a amamine. Then and for some reason, I learned in medical school when I came back from outside. I learned one thing in Ghana here, that every condition in Ghana here.
Amamine is
amamine is part, and there's another one. There's a condition called this word was like.
Is it a tree word?
It's a tree word. It's for pals. There's a word for pals. Cocoa. Everything's cocoa. So since you are a cocoa, so Okonya you are a cocoa, so Tio you are a cocoa, like even the cocoa of the eyes.
But Doc, let me just digress. Just because you mentioned it, I was watching a documentary. It was a research on Dr. Sebi, and he's mentioned something about phlegms actually being, a major cause or major part of like diseases existing in our bodies. Is that?
Yeah, because it's retained bioproducts. Like you digest stuff, things are left behind. You don't detox. It doesn't clear. A lot of people are retaining a lot of things that should have gone out. Those listening to us, how many people actually started on WC today?
Yeah.
How many people took the time to drink a glass of water before stepping out? Because when your body has been in that form of stasis for 8 hours, 5 hours of sleep, 7 hours of sleep, there should be a sort of wash down. The way you take a shower, everything is sort of like, we don't do that because we're in a hurry. Work. You are late. You need to get to the vehicle. You need to, so much going on. So yesterday's food is still in there. We're going to pile on today. Then 3 days. There are some people walking around 3 days, 4 days. They've not seen the loo.
Wow.
Dangerous.
And when they use it,
dangerous, sir.
You might call. You have to call your fumigator. Air freshener won't work. Because the advocacy for STIs, we are sitting and we are laughing about it, but it's so bad that if it gets to a point, and women at a more, I feel like, a disadvantage, because then it can cause you to become infertile.
Oh, yeah. But you not UTIs, but STIs don't cause men to become infertile.
It can.
Okay,
what I'm trying to say that because of the
women are more open.
Okay. Look at the word open. Like you get literally.
Yeah.
They are more open. Like it's a two-way street. I always say one-way street. Instead of repeat, ejaculate comes one way. Yours is men's is childbirth, sex. Like it's the same road that is doing a lot of things. So that's why it needs to be optimal.
Maybe that's why women are good multitaskers. Maybe
because you're born multitasking already.
Yeah, maybe that's part of it. Okay, so Doc, you mentioned that HIV is very much a part of it, right? But also let's just say that for someone who wants to get proper treatment, maybe the person has found out that there's something off in my body, okay, maybe my urinary tract, or I'm peeing and it's painful, or
Right.
I feel sick in X part of my body. When these people come to the hospital, do you find that they are able to open up, about what exactly is wrong with them, or do they go around in circles? Do the people who have infections make it difficult for doctors to properly diagnose whatever is wrong with them?
Before I go on, Debbie, if you listen, the image before the gonorrhea image, please prepare it. Now, as you said, most people come lying.
Okay.
A lot of people lie because I don't know if it's us and the stigma. You mentioned the word the stigma about how we approach it. That if
I think
somebody
yesterday we said something
Yeah.
about how culturally sensitive it is.
it
We
is,
don't talk
yes,
about,
we won't talk about
yeah,
it
these
because
things.
they come in, and if the person is underage or has a guardian, they usually come with a guardian. And there's this preconceived perception.
yeah.
You have a parent who feels the child is holier than thou. It's not possible. There's that. There's that.
Yeah.
And there's those that believe that it's spiritual.
Oh.
Then there's those that are educated enough to know that maybe their child is doing this and that, and then they are pissed, like really upset that you didn't, after all the training. There's then there's a fourth category. They know nothing. Ignorance.
Yeah.
Jon Snow's.
They don't know what's going on. They don't like. I think those are the absent parents.
Yeah.
Like they work so much that they don't really know where she or he has been to. So you need to, in asking questions, you need to be careful, because these two people are going to go home together.
Yeah.
When you are done, these two are going to go home together in the same vehicle. Problems could arise. So you start from the point that by making the person comfortable that this is a safe space, you can talk about anything. So I like to make jokes with it and be like, maybe if the mother is okay, she can step out, because you have a chaperone, a nurse can be a chaperone. She comes in, and I usually like nurses who are open-minded.
Okay.
Some are, some
They'll go and tell your mother.
the
Okay.
word of God, and yeah, the person has done something wrong. Let's put that aside. That's for between you and God. But here, we need to get to the root cause of the problem. So you need the person to open up. Where did you get infection from? What happened? When did you see it? How long has it been? Are you seeing other people? Then you have to also sometimes talk about that. Some like when you say, "Oh, me could have a girlfriend," though. Me is it when you say that.
You make them
May feel that no, I'm not also that. So they lie. The lies there is a lot. You have a patient who comes to you that I have one that says that the genital warts. So we're suspecting HPV. The genital warts. So it started on the neck, and it was like rashes. And then she bought a cream. And when she applied the cream, then it went away. Then she forgot, so she touched that area, her genital area, and she thinks that maybe it transferred. It transferred there. And I was like, wow, oh, yeah, it's possible. I told her it's possible. Yeah, it's possible. Like it's really possible.
But it's not.
But it's possible. So do you know what we'll do right now? I'm going to let the nurse come in, and then we'll take a look. We'll take a sample. We'll test and see. Maybe it's just pimples. If it's pimples, we can, Farm is there. We're gonna buy a lot of things and choose it. Then she was cool with it for us to now look, because some are very protective. Like you ain't gonna look.
That judgment.
No, but I think that once you decide to go to the hospital,
Oh, you have no idea.
you should know that they are going to test you, they are going to check you as well, because they need to do all of that to be able to say that this is what is wrong with you and this is the medication that you need to take, right? But also, do you think that the doctors or the nurses have a part to play in these
big
people
part.
Yeah.
lying or not being honest about what it is that's happening to
Have
them?
you ever entered the hospital in the morning before?
I have.
Yeah.
The first person you meet will determine how your day is going to go. How the nurse approaches you. Sometimes most of us enter hospital, we are confused about how things are done
Run,
here.
yeah.
Like, where do I go first? You need to go somewhere. Maybe you have a folder. Like, most people don't know anything. So you need somebody to walk you through. Okay, first you check your vitals and then take your name and then you go here. The person meets you like, you get up and you've been sitting for a while. So you're wondering what's going on. Like, nothing's happening. Like, oh, Pastor, Dr. Nabana. Or like, what's next? There's something I can do. But most people have to go to work. Or maybe tenancy.
Yeah.
I don't really want here. So it's created this thing where hospital is not as friendly for people as it should be. It actually should be the place where everybody should be excited to go to. Because it should be the place where there's no judgment. Nobody has anything against you over there. But for some reason, some facilities, and we are praying that change comes. There are some that are good, some nurses are really good.
The prayer will not help. We have the
change
prayer,
of mindset.
The prayer won't help. Like we were saying yesterday, we need a reorientation. We need to draw people's attention.
You think maybe health workers should do what's that thing they do for people who do customer care? Training program?
Yeah, the workshops.
The workshop how to communicate.
They need to.
Yeah.
And I think that even the media has like we're doing. The media has a very important role to play in sensitizing, not just because it starts at home. Like if you are comfortable enough to talk to your parents, or your parents are comfortable enough to talk to you about it, then it will be easier. I mean, even if you do something wrong, it will be easier for you to go back to them and say, this is what I'm experiencing because I did ABC, and then you guys will find a solution. After that, you can pray to God together.
Yeah. So let's be less judgmental.
Let's take it out because you have a young person, whether it's been molested or, because most of them they are lied to.
Yeah.
Oh, and you're sharing secrets, and then the person sleeps with you and you get an infection, right? It's not in our place.
Yeah.
Right.
And so out of naivete, they might not know that
it's even an infection.
Yeah.
So some come at this end stage, it's getting worse. And Ghana here is like that. Things get really worse before people show up in the hospital.
Yeah.
Simple boil. People keep it for so long, it becomes surgical. You have to actually go and open it up and remove the pus. Like, we always wait to the end. And sometimes I'm thinking, this is like a 5 cedis treatment. This is like a 10 cedis treatment. All of a sudden, it's becoming 3,000, 4,000. All of a sudden, your arm is up there.
Like
you can't put your arm down.
Like we're saying, the reorientation is very important because I don't want to even take myself out of it. This thing we're talking about, like being in a situation where something is wrong with me, but the last thing I want to do is go to the hospital. And Lenny can attest to that fact. Lenny is literally always pushing us to go.
Yes.
Weren't you sacked?
Otilo.
I was here. You were sacked. You actually sacked to go.
You get what I'm trying to say. Sometimes
have you gone to the hospital?
Hey, I'll put on you. Wow, trip. Wow.
I thought we're in this together.
Okay.
So the reorientation is very necessary because the last thing I want to do is to go to the hospital with what's wrong with me for a nurse to come in my face and make me feel bad about it. And it could be it doesn't even have anything to do with sexually transmitted diseases. I'm just going there, but I feel bad because I know what I should have done that I didn't do that's causing me the pain that I'm in right now.
Yeah.
And I get there and I know that when I get there, the doctor will remind you, but I told you to do this. And even with that,
stopped.
Don't look in my eye. I know you're giving me bombastic side eye. Even with that, as trivial issues like eating well, people who have drinking issues that go back to the hospital, even those people, they lie. How much more sexually transmitted infections? You get what I'm trying to say?
How many bottles do you drink? Dog, last time it was 8. This actually we spoke about now. Just one.
People are lying.
And so
that means that we need to just create that environment.
That
and that should start from home as well, right? From the home.
And it starts from and also us, and we also take it from our side at the healthcare facilities by smiling more.
Okay. Yeah, it's very important.
Being jovial a bit. Being jovial a bit. I think we've taken the work the work is serious, but sometimes our teachers sometimes tell you that sometimes somebody is just there to talk to you. Like it's not even they just want somebody to have a chat with, and you realize that because after chatting with the person, half of the time you figure out what the problem is because they will tell you everything in that conversation. And you don't need to ask, no, you just allow the person to flow. You start hearing. You say, okay.
Then you can
take
your notes.
Far away. Oh, okay. Oh, okay. So by knowing the drug, you know what treatment was the person was put on and all that. And most people forget the names of medications and all that. So when you're talking about STI, the first thing is that we should protect ourselves. It's you first. When the problem starts, it's only you. And healthcare is so expensive these days that I'm always telling people, don't bring yourself. Do the preventive stuff. Right? Do the preventive stuff more. Because if you Trip asked the question that how do you tell if the person you are with is safe? I think both parties have to walk into hospital and get tested. The question is, how do you convince your partner to get tested?
Yeah.
Doc, talking about that, I was going to ask, how frequently
Should you get
we
tested?
Need
Every
to get
6 months.
tested.
Every 6 months, if you are with one person.
Okay.
Emphasis.
Every 6 months, if you are with one person.
Okay.
The next point, if you are changing partners, with the change of relationship, every time you change your partner, get tested.
Yeah.
Both of you.
Okay.
Every time you change your partner, get tested. So, and if you are, are you sleeping? If you are dating,
No, Doc. You should say sleeping because a lot of people are.
if you are sleeping with,
Reality
if you are
on
sleeping
ground.
with
Yeah.
3, 4, 5 people, it should be tested every month.
Hey.
Wow.
Well, you are
That's a
the
lot
one
of
doing
stress.
it, so you get it's
That's a
your
lot
work.
of stress, though.
No, but we don't take much. It's just a little
But it
blood.
means you also have the responsibility of telling these other 5 people that, hey, I'm getting tested.
Do you know how
So-
contact tracing works for these things, these kind of infections? We didn't even talk about it. You come with the infection. We have to look for the person who either gave it to or you gave it to.
They have to go and bring.
You have to go and bring the person. And most of them, they don't come back.
It's like a pyramid scheme.
Yeah.
But
It's like a
look,
web, a big
they
web.
can't come back because it may be difficult for them to
To go and tell the person.
identify
Yeah. No, if,
who it is.
apart from
that-
identifying, telling the person. If it's a
Yeah.
problem, like I went to hospital, they said this.
And let's say the person you go and tell, that's not the person who even gave it to you. So you now have to go and tell the other
Somebody
person
else.
or the other
That's
person.
embarrassing.
Imagine coming to the hospital with
Three
three
four
women
people?
or 3 men.
we've had
different.
brave people do that.
They come
Oh,
at
wow.
once or
They didn't come at
one-
once.
Okay.
We realized that if we write reports.
Yeah.
So as you write reports, you could see the trend that
Yeah.
this
You're
connects to
able to
this, this
identify
connects to
the
that,
patterns.
right? And then you have a situation where we had 4 ladies and a guy.
Hey,
All the 4 had infection.
But, Doc,
All the 4 had infection except the guy.
hey, okay.
Carrier.
That means
he's a carrier.
He's a carrier. Asymptomatic. He's a carrier. So he just
oh,
He's dishing out.
okay.
So
There's that.
he didn't know. He didn't know too.
But Doc, I don't think we've been able to fully, get into this understanding STIs, right? But also just run us through the list for the sake of time.
Yeah, so
There's a
share the image-
possibility
let's share
that
the image
we'll,
now.
We'll move it to next week as well. and
Let's share the image
continue.
now.
But yes,
I want to
Debbie,
talk about the symptoms everybody should look out for.
for
any form of
is it-
STI. I did a
okay,
general-
any form of STI,
it
and
can
then
be any
you
of
run us
them.
through a list of
Yeah,
STIs,
yes,
and
yeah,
then
then we
wrap
close,
up.
yeah.
Yeah.
Do you have it? Yes. So I did a commonly sexually transmitted infections, right? So many do not cause symptoms or symptoms may not appear for a long time. Therefore, it's important to get tested. Let's get that tested. So now the first one is genital herpes. We talked about that. Now herpes is itchy, it's painful bumps that you get, fluid-filled blisters. Like the way when you use a cutlass, you weed, it forms
Yeah.
like that.
Okay.
So it can be on your genitals or your buttocks or other areas, right? Now there's medication for us to. I don't want to write medication. People look at it and go and buy. So I don't want to add
That's
that.
fair.
Yeah. So then we have chlamydia, which people call clap. Chlamydia and gonorrhea, right? So we have burning during urination, unusual discharge, painful or swollen testicles, bleeding between periods. For the women, bleeding between periods, gonorrhea or chlamydia. Now, then you go to the hepatitis, flu-like symptoms. Now you have flu, you have nausea and vomiting, you have abdominal pain, and your urine is dark or clay-colored stool. And you have jaundice on top of it, yellowing of the eyes, yellowing of the palms and under the feet. You should know that you are in hepatitis.
Yeah.
Then you have HIV/AIDS, which everybody knows, flu-like symptoms and rashes and all that. Then you have HPV, genital warts on the cervix, penis, and the mouth, and then the anus. Then the last one, I can't see. Do you mind reading? The
Syphilis.
syphilis. So you have syphilis has the sores, the skin rashes, fever.
swollen
So if you
lymph
have skin
nodes.
rashes and you have your lymph nodes, they are here. You have like this swollen bump, like beads under your skin. Then you know that, and you have a fever on top of it. Then you know you are in syphilis family, especially when you've had unprotected sex and all that.
Okay, it's not necessarily malaria.
It's not
because some
necessarily it's
people
not necessarily
will say
malaria. It's not
that-
necessarily a common cold or a flu-like symptom. No, as soon as you see that fever, sores, skin rashes, please quickly. Then genital itching. Any form of genital itching is a no. Whether it's a UTI, it's a don't. Rashes in the genital areas, no. Those who have been kissing people lately, please, if it's possible, look in the person's mouth.
Hey,
Because these days we are.
Before
Because
the
you are
person
seeing there's this
finishes
white.
opening their mouth,
I
then-
used to have an image where these people have these rashes on their mouth, like pimples on their mouth. Yes.
it may not be fever.
Yes, that's it.
Oh Jesus.
Why?
Viewer discretion,
Question is-
please. Viewer
So
discretion, please.
you can take it off now. If people have seen it, so this is herpes simplex virus. See how it comes?
Yeah.
So no symptom anywhere. This is it. Starts with a rash. That you see.
There's a last.
You see it's fluid filled.
There's a last STI on the list. So if we can just look at the last one on that list. If you can get the list back up, okay.
Is that how to pronounce it?
I thought Lenny would pronounce it for me.
Yeah, so when it comes, I'll see. We'll try and pronounce it. Even if I pronounce it wrong, me,
There's
I'm
it.
a
There you
medical
go.
person, so trichomoniasis. Is that what it is?
Yes. So
Trichomoniasis.
you can get it from skin to skin contact.
Is it tri or trick?
Try.
Try.
Yeah.
Okay. All right. But
So-
the short form is trick.
Yeah. Yes.
Okay.
So you have genital itching, burning, discharge with bad odor. Discharge with bad odor. We know UTI has that.
Yeah.
You see why STIs, they mimic a
They
lot
can
of
replicate.
yes,
Yeah.
they mimic a lot of conditions that you think can buy an antibiotic and you be done with it. And the people who see some of the symptoms and go and buy antibiotics from pharmacies, be careful, because the more you take those antibiotics, if it doesn't work, when you come to us, maybe that antibiotic with a combination could have helped, but because your body has gotten used to it and the virus has created a defense against it, you're high tolerance, so it's not working anymore.
Right. Okay.
The worst you can do to any infection is to empower it, for it to learn that this antibiotic doesn't work against me,
Women empowerment.
right?
Yeah.
So the last thing I will say is this: next week I'll continue. Next week I'm going to talk about the more serious. I'm going to bring you more images. I'm going to talk about it in depth, in the sense that we're going to do it case by case.
Okay.
How it presents, scenarios where it presents, and how to manage it.
Okay.
It's simple. The more you're exposed to penises and vaginas, the more your risk of getting infections. The licking, the kissing, right? Even sweat, hepatitis,
Yeah.
and that's your liver. Hepatitis is your liver that is going to shut down. And Ghana, I don't know if we do transplant. Who wants to share a liver? So, and then people can say all this, and all of us can sit here and say all these things, and then the decision is yours to make.
Yes, because we cannot tell you go,
It's your
don't
life.
go, abstain, don't
Because
abstain.
it's
We've done
condom
our
or
bit.
pregnancy, right?
Yeah.
Condom or pregnancy, condom or infection, abstinence or infection, marry. Because even in marriage, as you said, people are still getting infections in marriages. So it might come to a conclusion that in the end, everybody might have to do a test monthly. But no, we might have to come to a law in the same one
Mandatory,
time,
yeah.
mandatory that when you enter hospital for even malaria test,
You have to be tested
you
for
should be tested for
everything
STI.
else.
But because it's your consent, we can't
Obini
do it without.
That's what I'm
Yeah,
saying.
it's because
Obiniyem. How is it that I've come for headache?
If
or
people
cold,
had
then
to go
I'll
to-
get
you know
that.
people are careful about that.
Yes.
People say, hey, Pacho, moja na out, you know, we pay a fire.
I really
I no pay.
I think that's even
that's
the
to your
best.
benefit.
Yeah.
No, I don't see that way.
You
Wow.
get to the hospital.
Especially when you're not the one
something
paying the
else is wrong
bills.
with you.
You're not the one paying the bills, and the ladies are the one paying the bills, the man is the one paying the bills. Because when the bills come, people forget medical reports is for you. It's not really. It's between we discuss it with you and that's it. If you want to show it somebody, leave it around and somebody will read it. That's your own problem. Well, we are not. God, the law doesn't allow us to tell your partner if you are positive.
Oh, okay.
Medical ethics.
Even when
I'm
you're
not-
positive that you're supposed to tell the person.
Yeah, we advise you and tell the person, but
Cause your trip, it's okay.
Is the
Okay.
chair? I've concluded. Is the chair?
well, there's something that says serious
Yes,
chair.
serious chair. Thank you very much. But guys, we've mentioned that we'll continue next week. So Doc will come back with more information for us on STIs. But with this that
ABCs,
we've
the
said to
ABCs.
you, we hope that we've managed to convince you and not to confuse you that it's okay if you want to abstain or be faithful, or if you're using a condom as well, you should not stack it up, and then also you should know which lubricants to use and all of that. So also now do your further findings and educate yourself as well. Really important. We've been talking about understanding STIs, and of course Dr. Chris Amina has been on top of affairs when it comes to our Health Tuesdays. Okay, we're going to continue next week like I already said. So yes, shouts to Trip and Silfa as well. But before we go, let's not forget to make that money. Okay, so let's do that, starting with Bedway. Bedway's Bed Saver feature helps you to save some money on your bets. Okay, so whether you've placed multi-bets and you are losing on some, the feature comes right in and helps you save some money and then also get way more, just like Bedway says. This is exclusive only on Bedway. Terms and conditions apply. It is regulated by the Gaming Commission of Ghana. Do remember to bet the responsible way.
Definitely. Now, also for those of us who want a British degree at fraction of the cost, definitely do well to reach out to Lancaster University, Ghana. If you want a vibrant student experience in a community that equips you with useful employability skills, taking you one step closer to the career of your dreams, then you can enjoy all of this and more, plus up to 50% scholarship for your degree at Lancaster University, Ghana. You'll be taught by the finest faculty trained to UK standards at their ultra modern campus. For more information, you can visit them at www.lancaster.edu.gh, and also their emails at admissions@lancaster.edu.gh, or you can also call them on 020-960-7008, 020-960-7008. Lancaster University, Ghana, the only British university campus in West Africa. Also knowing that every time we eat, food and sugars are trapped between our teeth, leading to tooth decay, gum disease, and in some cases foul breath. Doc, real quick, when you brush your teeth, can it cancel out?
No.
No, please.
You see, Len, it's very important to ask. Some people think that they brush it, it's gone. It's not gone.
Well,
Okay.
It's not going.
teeth is for cleaning your teeth. It's not disinfecting.
Great.
Yeah, okay.
Awesome. Now, brushing your teeth every morning and night with Pepsodent charcoal and Pepsodent herbal toothpaste is essential for your breath and cleaning your teeth. Okay, Pepsodent charcoal is made of a fine blend of fluoride with a unique combination of natural charcoal, lemon, mint, and zinc to whiten your teeth, strengthen it, and remove bad odor from your mouth. And for our herbal lovers, you can try the Pepsodent herbal toothpaste, which is infused with a unique blend of green tea and herbal extracts, formulated to repair and protect your gum while giving you an all-round cooling sensation. Always remember to brush your teeth in the morning and before you sleep at night. Pepsodent has been educating Ghanaians on how to brush their teeth for the past 26 years, and so definitely do well to reach out to them on their toll-free number 0800-161-000. Again, 0800-161-000 to talk to a dentist for free. You can get Pepsodent anywhere at any shop near you. Pepsodent, every smile matters.
Every smile matters. So while you're protecting yourself, protecting your mouth, you also need to protect yourself from germs and bacteria, and you have to do that with confidence. Cleanse hand soap will effectively kills 99.9% of germs with every use. It's perfect for all your hand washing moments throughout the day, and it is available in a variety of invigorating variants and delightful flavors: aloe vera, strawberry, vanilla, and honey, antibacterial, and chocolate as well. So choose the favorite for yourself, your family, and your friends, and make Cleanse your daily essential. Stay clean with Cleanse, the GC brand. It's all about you. Also, we have the Telecel More Money promo. Now we're at the final draw where the Telecel More Money promo is getting exciting as it gets to its peak, with over 50 winners having already walked away with 30,000 Ghana cedis each in the weekly draws. And we are getting closer to rewarding one customer with a grand prize of 1 million Ghana cedis in a Telecel More Money promo. That lucky customer could be you. So keep purchasing data, airtime, or reload your fixed broadband to get closer to becoming a millionaire, okay? Now, the more you reload, the better your chances of winning, so don't miss out. Dial star 500 hash or send win to 500 or visit the Telecel Play app to opt in for free. Join the Telecel More Money promo now and make your holiday season even more joyous. Terms and conditions apply. The promo is regulated by NLA on the Characters Lottery platform. Telecel, connecting energy.
And just like that, we've come to the end of the show. This is saying thank you so much if you joined us from 7 a.m. or if you joined us midway throughout the show. Thank you so much. And thanks going out to our own family member, Dr. Chris Amina, for always showing up and out for us on Tuesdays. We really appreciate it, Dr. Chris. And also, happy birthday going out to Lady Rebecca Donko, owner of Makeup Ghana. I hope that you have a great day. And to you as well, I hope that you have a very fruitful day today. Catch you tomorrow. The show is Culture Daily, the station, 3 Music TV, plus 89.9 FM. Bye-bye.
Culture Daily was brought to you by Telecel.